Diabetes mellitus. Diabetes mellitus is a group of metabolic disease characterized by elevated levels of glucose in the blood, that is hyperglycemia, resulting from defects in insulin secretion, insulin action, or both. Normally, a certain amount of glucose circulates in the blood. The major sources of this glucose are absorption of ingested food in the gastrointestinal tract and formation of glucose by the liver from food substances. Insulin, a hormone produced by the pancreas, controls the level of glucose in the blood by regulating the production and storage of glucose. In the diabetes state, the cells may stop responding to insulin or the pancreas may stop producing insulin entirely. This leads to hyperglycemia, which may result in acute metabolic complications such as diabetic ketoacidosis (DKA) and hyperglycemic hyperosmolar non-ketotic syndrome (HHNS). Long-term effects of hyperglycemia contribute to macrovascular complications such as coronary artery disease, cerebrovascular disease, and peripheral vascular disease. Chronic microvascular complications, kidney and eye disease, and neuropathic complications, that is diseases of the nerves. Risk factors for diabetes mellitus are family history of diabetes and obesity, previously identified impaired fasting glucose and impaired glucose tolerance, hypertension 140/90 mmHg and more than that, and HDL cholesterol level 35 mg per deciliter and more, and triglyceride level 250 mg per deciliter and more, and history of gestational diabetes or delivery of babies over 9 IBS. Classification of diabetes. There are several different types of diabetes mellitus. They may be differ in cause, clinical course, and treatment. The major classification of diabetes are type 1 diabetes, previously referred as insulin dependent diabetes mellitus (IDDM), also called juvenile diabetes, juvenile onset diabetes, ketosis prone diabetes, brittle diabetes, and insulin dependent diabetes mellitus, that is IDDM. And second one is type 2 diabetes, referred as non-insulin dependent diabetes mellitus (NIDDM), also called adult onset diabetes, maturity onset diabetes, ketosis resistant diabetes, and stable diabetes. The other one is gestational diabetes mellitus and diabetes mellitus associated with other conditions or syndromes. Thank you.